Hi, I'm Catherine, and in this video, I'm going to show you how Public Editor evaluates the use of evidence. The article we're looking at here is claiming that doctors who are more likely to prescribe opioids create opiate addicts. Well, I don't know about that. Let's see what kinds of support the author gives and how compelling the evidence is. Let's look at the first question. Is a general or singular causal claim made? General causal claims are generalized statements about general patterns of causality, like smoking cigarettes causes cancer. Singular causal claims are more anecdotal and often harder to prove, like smoking cigarettes gave my friend cancer. In our case, it looks like they're suggesting that doctors who prescribe higher doses of painkillers cause more opioid addiction. That's a claim of general causation, higher use with higher dose prescribers. So I'm going to select general causation and highlight the text to support my answer. Next question. What evidence is given for the primary causal claim? Let's see. There's clearly correlation. Higher opioid use correlates with higher dose prescribers. That's indicated by this sentence. 30% higher use when patients saw higher dose prescribers. It might be the case that the cause precedes effect, but from the evidence given here, we can't really tell. Does the correlation appear across multiple independent contexts? Not in this piece. Is a plausible mechanism proposed? Yeah. The author made it pretty clear that with higher dose of painkillers, patients are more likely to get hooked. That seems plausible. I don't see anything else mentioned in the passage, so I'll click Next. How representative is the sample of the population? I can't really tell that from the bolded text here, so I'm going to look for a little bit more context to evaluate this question. Let's see. Who are these people? They are 375,000 Medicare patients who turned up in an emergency department for common reasons. Is it representative? It's hard to say. It's a lot of people, but all at the same hospital turning up in the ER. Also, Medicare patients are older, so also not exactly representative. I'm going to say somewhat representative. If you were worried about the age might be the major factor, making it really hard to generalize, it would be reasonable to give it an even lower rating. These are judgment calls. For the final score, an average of people's ratings will be used, so don't worry too much. Just give it your best answer. Next. This question is asking for an alternative explanation for the evidence. If you can think of another explanation that's just as good or even better, that means the evidence here in bold is not so convincing. It's hard to think of another explanation, but maybe the patients who go to the higher prescribers are patients with more pain. So of course doctors are prescribing higher doses. So I'm going to write that down. Doctors who prescribe more painkillers are seeing patients with more pain. That's definitely a possibility. It explains all of the evidence just as well. How likely is my explanation compared to the authors? Well, it's hard to tell because I'm not an expert, but fortunately I'm not the only person evaluating this. I'm going to say somewhat less likely, because I'm not really sure how different patients get assigned to different doctors in the ER. Is data presented as evidence for a pattern? Yes, right here. Next. Is it likely to be a random statistical variation? That means, how likely is it that this result is just noise? Like, if you flip a coin enough times, there might be a run of 5 or 6 tails that could make it seem biased if you only look at that part, even if the coin is totally fair. Well, this is a pretty big sample size, 375,000, and the effect size is pretty big. So I'm going to say very unlikely. Is it likely to be a systematic error that could not be canceled out by collecting more data? That means an error because of some systematic bias in the study design, because of the kinds of people, or the hospital, or the way they measured addiction, something like that. Well, I had that alternative hypothesis that maybe the doctors who were prescribing higher doses were seeing patients with more pain. That would be really big systematic error that would lead to the same effect. So I'm going to say somewhat likely, because that seems pretty plausible. Next, does the author suggest in any way that further evidence may improve our understanding of the topic? Well, maybe they do in another part of the article, but not in this piece. So I'm going to say I can't tell. Now we're almost there. How difficult was the task? The bolded text wasn't too bad, but it took me a bit to think about the alternative explanation. So I'll give myself a 4. How confident am I? Well, I did think it through before recording this video, so I'll say 9. You may have noticed that this task took a little bit longer than the others. The evidence specialist is one of the trickiest. But don't worry if you're not sure. That's why we have multiple people doing the same task. And remember, we're here to help. Click on the help boxes for tips or refer to our field guides. Every time you do a task, you become a little better at thinking critically about evidence. Thank you for your help, and I hope you enjoyed it.